So you've got Dr. Nassif here. A lot of you guys will know him from the academy. So we're going to talk a bit about psychosocial in PLAB 2, isn't it, Nassif? And we've seen a lot of people in mocks, we've seen a lot of people in the academy. Obviously psychosocial is one of the 3 Arora bubbles that we talk a lot about and teach a lot about. Let's talk a bit about some of the mistakes that maybe we see often people do when it comes to the psychosocial bubble. What kind of things have you seen in mocks when people doing Roleplays, PLAB 2?
Yeah, I think in the mock exams, you tend to see some candidates who will kind of go through a checklist of questions with psychosocial. They're asking things which might be relevant to some cases, but not others, but then asking all those questions, and some of them may not be relevant. Sometimes they're asking about things like diet, exercise, which may not be relevant in that case. Sometimes things like adapting it, so work, school, and just automatically asking about work when the patient's not at work.
That's a child.
So you've got to kind of respond to what the patient's saying.
So a few things you mentioned there. So I guess the first thing we really see a lot is tick boxing, isn't it? So people kind of understand that in an exam like PLAB 2, you do need to find out about their life, so they get that bit, but maybe it comes across in a very scripted way, so kind of out of nowhere, what do you do for a job? And then you'll get an answer, I don't know, a carpenter, and then it's just move on. And so one thing is that type of question, what do you do for a job, who's at home, do you smoke, do you drink, what's your diet like, what's your sleep like, and it goes on and on, doesn't it, sometimes? So that's one thing we definitely see. Tick boxing is something that you know, interpersonally, it's going to sound like I'm just trying to grab marks, isn't it? It's not going to sound like you're genuinely interested in their life. So that's one thing you mentioned, and you mentioned relevance, isn't it? Like sometimes you're right. One of the commonest questions we hear is, "Can you tell me a bit about your diet?" And sometimes it's like, you know, we have to, when we go through the feedback, talk about, well, what was the reason you asked about diet? And actually, they can't often come up with something. So obviously diet is important, but when it comes to psychosocial, that's a good point, that you only want to ask it if you can show an assessor that you've chosen this for a reason, isn't it? So diet is a nice question, but it has very little relevance in a lot of cases, and it shows straight away somebody who's just doing something for the sake of it. Whereas there are some cases, of course, where diet is super important. Diabetes, obesity, hypertension, you know, these things are important to get them in, but it's that choosing and showing that as a clinician I understand when this is actually potentially important. And that we don't often see.
It's understanding what idea the role player is giving of their life and what they do, and then applying those questions accordingly, and not in a checklist manner. And the other thing we talk a lot about is the two-wayness of it, isn't it? And sometimes people don't look at it both ways. They look at, for example, okay, someone's got a symptom, what things in their life could lead to that symptom, and I'll ask all those questions. But then they don't go the other way and think, well, how is this symptom impacting your life? So we talk a lot about the need to go 2 ways in psychosocial. How is life impacting medicine, and how is medicine impacting life? And often when people come to the front and do cases, they'll get it one way, but they won't go the other way. And I think if you go into it thinking, I've got to think of it 2 ways, you're less likely to miss those kind of things. But do you see people do one and not the other? Sometimes, it is quite common. Some people will do just the one. And then again, it comes across in a way which is just asking for the sake of it. Asking quite generally as well, not applying it to what's been said about. For example, if they do a certain job, that it might affect them. If they do manual labour, and they're suffering from pain. Applying it accordingly.
That's an important point. Like, if you go back to that job bit, like I said earlier, a lot of people just ask the question, get the answer, move on. But often people don't push when they need to push, isn't it? So say someone's coming with, I don't know, knee pain, and you say, what do you do for a job? And they say, I'm a carpenter. Then they really should be pushing that through, isn't it? Okay, so are you doing things at work that are making this worse, or do you find it's better when you go home, or you know, is there anything at work that you think might be making this, you know, more difficult for you, etc. And that shows an assessor that you've asked a question about work, but you understand that from the answer you need to push. And that's so key, and people don't always push, and they're not maybe nosy enough about their life, because that's important. Because if that person is struggling at work and you don't find out about work, then how are you going to discuss that work later? Isn't it? And then the other thing is that people will then say things like, or they'll say generic things in the second half, like, why don't you take some time off? You mentioned your carpenter taking time off. And the guy's like, well, I can't take time off because it's my own, I'm the guy who does it, I've got clients waiting. And if we'd done a bit of work around that in the first half, then you'd have a bit of a specific suggestion for him in the second half rather than something generic like, well, why do you take some time off? Which people do say, but they say on the back of not knowing enough about the job in the first place. So that pushing through is really important. What about home? Like, what kind of things do you see people do around the home question? Do you see them just asking who's at home, get an answer, move on, or do you see people pushing it when they need to?
A few will push it, but a lot of the time it is who else is at home. Okay, and the next question.
And why do you ask about home? It's not just to find out who's in the house. It's, I suppose, a couple of things, isn't it? Number one, support systems. That's so key. We talk a lot about that, don't we, in the academy. You need to understand who is this person's bedrock, really. Who's the person they're going to talk to at 12 o'clock tonight when they're stressed about what's happening in the clinic, or who's the one that they talk to when they've got this worry about cancer, have they spoken to anyone else? Who's going to be with them when you do a 2-week referral or an urgent referral and they're worried about cancer? Who's going to be with them for the next 2 weeks? Who's going to go with them to the clinic? This is support system, isn't it? And I don't know if people often push that enough.
Yeah, it's probably not. Sometimes it is, but probably not enough. Not enough.
Yeah, so support system is key. Obviously, who else at home can be practical as well. You've got a child who's got a viral infection. Knowing who's at home is important. Have they got siblings? Have they got the same kind of symptoms? These things can all help in the second half. But again, if it's just done as a who's at home, well, it's just me and my husband and my 2 kids, move on, then you maybe missed a bit of a trick, really, isn't it? To understand a bit about that social network. And I guess the other thing about home is how are people coping, isn't it? So we can say an elderly care case, someone who's got, chronic arthritis. Who do you live with? Live with my husband, move on. Well, okay, how are things at home and how is this impacting you? And are you able to do the normal things that you do, cooking, cleaning, etc.? There's no point finding out about who's at home if you're not thinking about these types of extended questions, right?
Yeah, agree.
And we see it a lot. You said at the beginning as well, the relevance, I think we see with the tick boxing, people may understand why they're asking a question, but if you don't show an assessor why you're asking the question, then the assumption can't be that, oh, you asked it because of this. And we talk a lot about verbalizing and reasoning, isn't it? And that relevance, that Arora R that we talk about in psychosocial. Maybe we should do an example, actually. Let's do an example of how I sometimes see it done not so great, and then let's do the same thing as done in a better way. That sounds good?
Yeah.
So what should we say? So do you want to be somebody who's coming with, let's say, indigestion, really standard, easy, easy, common presentation, right? Yeah. Let's do it without any kind of relevance or tick box in it. So Mrs. X, thank you for all those questions about your indigestion. So who's at home with you? Who lives with you?
I'm a wife.
Okay, great, that's nice. Do you work?
Yeah, I do.
Okay, what do you do?
I'm a teacher.
Teacher, okay, fine. Can I ask if you smoke at all?
I don't smoke. No.
Okay, that's good. Can I ask if you drink any alcohol?
I do on occasions, yeah.
Okay. And how would you say your diet is like? Tell me an average diet day.
Just the normal stuff, really.
Okay.
Just a pie for dinner.
Okay.
Yeah, sandwiches for lunch.
Okay, yeah, okay, fine. So it's okay then. And do you drink caffeine?
I do drink coffee.
Okay. How many?
Maybe 2 cups a day.
Okay. And are you stressed?
Generally, yeah.
Okay.
Yes,
fine.
teaching's a hard job.
Okay. All right, thank you then. Now let me ask you a few red flags. Okay, stop. Now, how often do you see that type of thing happening? Particularly early on, when people first come to the academy, or maybe in early mocks?
Yeah, in the early stages, a lot.
Yeah. And then we put in the changes, and then people hopefully don't sound like that by the end.
Yeah.
So maybe let's repeat that then, in a more relevant way. Okay, so Mr. Exposure, thank you for answering all those questions about the indigestion. That's really helpful. Sometimes with things like indigestion, there can be links in things like lifestyle, and I've not met you before.
Okay. Yeah.
So I'm just going to ask you a few things about you and your lifestyle, just to see if there could be some links there. Is that fair?
Yeah.
Sometimes things like what we eat can really trigger off indigestion. Have you noticed, firstly, anything that you eat in particular that makes these symptoms worse?
Sometimes after dinner I can get
Okay. So you mentioned dinner there.
Yeah.
What's your diet generally like? What sort of things are you eating at dinner or the rest of the day?
Sandwiches normally at lunch, that's
Okay.
not a problem. At dinner, I think when I'm having a bit of a heavier meal, like a pie, I sometimes can get
Okay.
a bit of indigestion after.
That's actually quite common, that heavy meals can often trigger it off. Also things like spicy food can. Don't know if you eat much spicy food at all.
Sometimes, yeah.
Okay, takeaways, junk food, anything like that?
Try to limit it, but maybe once or twice a week.
That's good. Sometimes that can make it a lot worse as well.
Yeah.
So that's really interesting. We'll come back to that. I think we can make a few changes there for sure. But there are other things that can trigger it up, other lifestyle factors that can make indigestion worse. Certainly things like smoking can make indigestion worse. Can I check if you smoke at all?
No, I don't smoke.
Okay, that's really good. The other thing that often can cause indigestion is alcohol. I don't know if you drink at all.
I do, yeah.
How much roughly do you drink? Would you say on an average day or week, whatever's easier for you?
No, just socially on the weekends.
Okay, so not a regular drinker.
Not a regular drinker.
Every weekend?
Yeah.
Every weekend. And how much on an average weekend?
A couple of glasses of wine.
A couple of glasses of wine, okay. That's important. I might come back and talk a bit about the alcohol later, because that can be linked actually to this type of thing. The other thing that people don't often realise that can link to indigestion is things like caffeine levels, drinking coffee and teas. Is that something that you tend to do?
I do drink coffee, yeah.
How much coffee do you have in a day on average?
Say 2 cups a day.
Okay. So that might be useful. That's important to think about. Maybe we can try dropping that down and see if it makes a difference. It's one thing to come back to for sure. And the other major thing that kind of comes with life that can link with indigestion, these kind of symptoms you're describing, is stress levels. Now, is there anything particular that you would say is stressful at the moment?
Not particularly at the moment, but like we are getting towards the exams and school has a lot of marking and exam sessions that we're doing, so it's particularly stressful, which I'm running.
Okay, so you mentioned school, so that means you're
I'm a teacher.
Okay, yeah, it's a stressful job.
Yeah.
And you say exams are coming up as well.
Yeah.
Okay, so what, a lot of extra marking?
Extra marking, extra sessions,
Fine.
extra revision.
And when would you say it became stressful, more stressful, let's say?
Definitely over the last couple of weeks, really.
Okay, and that kind of links to what you said, isn't it, with your symptoms getting worse over the last few weeks. So maybe that's an important thing to talk about. You've not taken time off work at all?
No.
Not got to that point? Okay, and are school aware of the symptoms you've been getting and getting worse? Have you discussed it with them at all?
No, I haven't.
Okay, fine. Okay. That's useful to know. I think that's really important to know, actually. The other thing that can sometimes lead to stress are things going on at home. Can I ask, how is home? Who's at home?
My wife and kids.
Okay, great. And have you noticed any changes there? How's things in the relationship? All the stuff going okay?
Yeah, everything's fine.
And have you spoken to your wife about these symptoms?
Yeah, she knows about it. She was talking about stress as well.
Yeah, okay, so she thought that as well, potentially. Okay, that's really useful. I think there's a few important things that we'll come back to that might be important to discuss later on.
Okay.
Cool. What's this? So hopefully whoever's watching can see the difference. Big difference, isn't it? I mean, essentially I got the same kind of information as a baseline information set. But in this one, number one, I knew a bit more about the important things. I pushed it a little bit. How much is the drinking? How much is the caffeine? What is the impact on work? What's the timeline in terms of symptoms and change in stress? I think you maybe understood why I was doing this more, which is personally is key, right? Otherwise, with patients, it might just be, well, why are they asking me that? I'll come in with this symptom. What's it got to do with this? And it gives me a lot then to come back to later, isn't it? I've got a few things now that, I can treat indigestion, I can talk about treatments and medications and whatnot, but I've got lots of other things to talk about. Whereas in the first go, A, I didn't show the interest in the first place, B, I had limited information about psychosocial, and C, the patient had no idea why I was doing it. So we see this a lot, and this is the kind of stuff that we talk about in the academy, isn't it? So in psychosocial, the key things that kind of came out there that I think are really important for anybody watching. Number one, make sure you're not tick boxing. Number two, make sure it's relevant. Get the signposts in, bring the reasoning back every time you do it. And number three, know when to go deeper. Don't just take an answer at face value, push where it needs to be pushed. And finally, I guess, trust the role player that they're not going to lead you down dead ends, right? Often we see this when people do practice in their own groups and things, that people don't often ask psychosocial in a lot of detail because they get stuck in, they go off a trail about something that's nothing to do with the case. Whereas obviously in an exam, that's not going to happen.
Yeah.
And you probably know this from mocks, isn't it?
Yeah.
we'll close doors when we have to close doors, but it's not relevant, we'll close the door. Whereas if it's relevant, we'll open the door and we'll allow someone to get that information. I think that's maybe a reason why people don't often
I agree with
do
that.
that.
Yeah. That fear.
Yeah. But then we were probably like that when we did our exams and practice in our group, isn't it? But that's why we're here. But anything else to add on psychosocial? That's kind of the key things we teach about in the academy, isn't it?
Covered the main points really.
Yeah. It's one of the 3 Aurora bubbles, so for those of you who are watching, you probably know what the 3 Aurora bubbles are. Psychosocial is definitely a big one. We'll teach you a lot of that when you come to the academy. We'll talk about relevance, we'll talk about doing it in one go, we'll talk about opening up certain doors when you need to. Next academy is coming up in a couple of weeks. Look forward to seeing some guys there.
Yeah.
You'll see Dr. Nassif there, as well as all the other guys as well. But hope that was useful. Stay tuned to the channel, subscribe if you found it useful, and hopefully we'll see you at the academy very soon.